So I will now begin the 2015 Board of Directors report. You will have received CNA's 2015 year in review this morning, and for those of you on webcast, you can access this report from the participant materials. And of course, after I have done my report and Anne's done hers as CEO, we will then open up to the floor for questions and to the webcast. So before I formally present the board report, it is very important for me to thank a few people who have helped make this wonderful year full of accomplishments. First, thank you to the volunteer members of CNA Board of Directors for your commitment to your governance role and to your profession, and for your support to me personally. I'm very grateful for all the hugs and all the support you've given me. To my two sisters, to the incoming president, Barb Shellian, it's been a pleasure working with you for these past couple of years. I will cherish the friendship we have built forever. CNA will be in such good hands under your visionary leadership. And to Anne, who I say is the right leader for the right time, I'm very grateful as you provided me with invaluable insights as we moved forward on so many challenges, and a beautiful attitude as we tackled different things at CNA. I would also like to extend my gratitude to my employer, St. Joseph's Healthcare in London, Ontario, and my CEO, Gillian Carnahan, for your constant support and for understanding the level of commitment that is required for the president of CNA. And I have 5 colleagues joining me from my organization here and at the biennial. Lastly, thank you to the members of the Canadian Nurses Association. Your engagement with your association and with the nursing profession is what fuels and inspires the work we do. It is wonderful to see all of you here today and to have others join via live webcasts. It is now my privilege to report on what we accomplished as an association and as a profession in 2015. And 2016 has been a busy year, but we are reporting on 15. When I assumed the president role, as you know, in Winnipeg, I said my term would be guided by a leadership promise, what I call the tagline. And the tagline, as you know, was "Unleash the power of registered nurses," a tagline endorsed by the board of directors. And I believe CNA's greatest opportunity to unleash this power lies in 3 areas: advocating through action, expanding the scope of practice, and leading always. Today's report will focus on what CNA has done in these 3 areas during 2015. First, advocating through action. It's the thing I will have most pleasure to take away from CNA. This area of focus is where we have turned the page in a very significant way at CNA. This shone through in CNA's campaign leading up to the 43rd federal election. We focused on championing seniors' health and healthy aging. Why? Because seniors are expected to represent almost 30% of Canada's population by the year 2030, and we must take care of them. CNA took a very proactive government relations strategy to the election, meeting with leaders of the main federal parties and more than 70 members of parliament and parliamentary staff. At each meeting, CNA urged the adoption of 3 key strategies to improve care for Canada's aging population. And these were: 1, to establish the common standards for home care across the country. 2nd, increase support for caregivers. And 3rd, improve community and home-based health promotion programs. Our CEO will tell you more in a few minutes about nurses' involvement in this campaign. Stellar. I think you'll agree we received great traction. Shortly after the election, the new Liberal government acknowledged CNA as a valued partner on healthcare solution when just weeks after being sworn in as federal health minister, Jane Philpott invited us to sit down and discuss the nursing profession's priorities for care. And you know the minister will be with us during the biennium opening ceremonies. And that partnership is also becoming stronger over time. For those of you who don't know, she will be here with us, but she has reached out to us in many ways, as have other policy and politicians. We no longer knock the doors of people. They come knocking at our doors. It's phenomenal. That's what I mean by the tides have turned. The page has turned. I'm so proud we were able to take 2 of the 3 asks that we had for the federal election over the finish line, because they are in the mandate letters and in the budget of this new government, and we continue to work relentlessly for harmonized home care standards with this government as well. While the election was a major focus, we added our voice to other healthcare issues, namely refugee healthcare. As you may remember, we encouraged nurses to sign a petition in 2012 calling on federal government to stop its cuts to health benefits coverage for refugees. Since that time, the battle to reinstate these benefits has waged on. In 2014, the federal government was forced by the courts to make changes in 2014. It restored some, but not all coverage. Not satisfied, we joined hundreds of others last June at the Day of Action Against Refugee Health Cuts. There was a collective sense of accomplishment amongst us when the new government reinstated full health coverage program for refugee and refugee claimants in early 2016. Very pleased. Of course, refugees were, for many Canadians and people worldwide, a major focus, driven by the major crisis unfolding in Syria. And I have worked in Syria as a volunteer, so it was tugging at my heartstrings what we were seeing playing out on the world stage. As we anticipated 10,000 refugees arriving from Syria before the end of 2015, CNA began working closely with the Public Health Agency of Canada and other provider groups. And I have to applaud Anne Sutherland-Ball and our staff. When we face circumstances like this, we are in tandem with the Public Health Agency and Health Canada to do whatever we have to do to meet the challenges in front of us. We also developed a new web page and published several articles in the Canadian Nurse in early 2016 to provide information on the health status of Syrian refugees and caring for a newly arrived family. Now, from advocacy to practice, and specifically to the second action item of my tagline, expanding scope of practice. This has been a priority with a particular focus on nurse practitioners and their roles, as well as the RN role with the RN prescribing framework. At this very meeting last year, our members voted on a resolution from CARNA to work with the federal government to amend legislation and regulations to remove barriers to full scope of practice for NPs. The list of federal barriers is long. Employment insurance, CPP, food and drugs, income tax, Canadian Labor Code, and the list goes on. We actively set out to amend the various acts and regulations through specific meetings with key officials at the healthcare programs and a policy directorate at Health Canada, Employment and Social Development Canada, policy advisors at the Office of the Prime Minister, the Parliamentary Secretary for the Health Minister, and the Federal Health Minister herself. We know this is on their radar and will continue to distribute our policy briefs at other meetings we'll be holding. After all, it's about providing people in our communities with access to the care and services of registered nurses and nurse practitioners. Our expertise on scope of practice issues is welcome outside of Canada. Last year, at the International Council of Nurses Scientific Conference in Seoul, South Korea, CNA contributed 6 presentations and an abstract on topics including nurse practitioners, clinical nurse specialists, leadership, the role of registered nurses in community care, and the status of RN prescribing in Canada, and we are making some great strides there. As an aside, Canada's nurses are members of ICN. Through their involvement in CNA, the country's only representative. I was honored when ICN presented CNA with the Membership Inclusiveness Silver Award, while recognizing CNA for the significant achievement of including in membership more than 50% of the registered nurses in Canada. While at the ICN meetings, CNA played a role in key discussions on global health human resources. In particular, we supported experts to develop an evidence-based paper that framed key nursing issues that were being discussed at the World Health Organization's first public consultations on a global HHR strategy. This paper was part of the ICN submission to the WHO and was on the agenda for the World Health Assembly that myself and other CNA members attended last month. We were part of the Canadian delegation with Minister Philpott, and we were the only NGO to be a part of that delegation. We should be very proud. An area that so many of us in the profession have been monitoring and adding our expertise to is, of course, the recent passage of the medical assistance in dying legislation. Our focus has been on ensuring the role of registered nurses and nurse practitioners is well understood and defined, and that people have equitable access to the service. Following the Carter ruling in 2015, CNA issued a media release outlining our priorities, that we would support nurses on the issue and help them provide the best ethical and competent care to patients either at or near the end of life, as per our Code of Ethics for registered nurses. As the work began on the development of the necessary federal legislation, stakeholders and policymakers began seeking CNA's expertise. In October, for instance, we were invited to be witness before the federal government's external panel on options for a legislative response to Carter versus Canada. I was very honored as CNA president to be appointed to the Provincial Territorial Expert Advisory Committee on Physician-Assisted Dying. This was established to inform the development of policies, practices, and safeguards to prepare for its legalization in the jurisdictions. Bill C-14 was introduced in April this year, and as you know, on Friday, June the 18th, this month, the Senate passed Bill C-14, a landmark moment in Canada as it ensures that Canada has a more compassionate healthcare system. As you know, Bill C-14 has passed. Many of our concerns were included, and now the stage is set to move forward. We expect to participate in ongoing consultations on some key points, including minors, people with mental illness, and those whose death is not foreseeable in the future. And I also want to make a point at this place that equally with our advocacy efforts on this legislation, our topmost advocacy, our tagline for this advocacy efforts was universal access to proper palliative care for Canadians. That has to frame the top of it. Finally, the third action of my presidency was lead always. It's actually a concept that runs through CNA's work. Our 2015 to 19 strategic plan, for instance, sets out for CNA to lead a shift in the healthcare system by rooting nursing back in its blue ocean space, which is primary healthcare. Primary healthcare focuses on the way services are delivered from birth to death across the continuum of care in all settings. It's about creating the conditions that improve the health of all Canadians and putting the people who receive health services at the center, and in fact, I would say in the driver's seat. A focus on advancing primary health care was at the foundation of CNA's work in 2015. Our particular goals with the strategic plan are to advance policy and advocacy, build capacity, and lead a system shift. For years, primary health care has been recognized as the way to achieve a sustainable healthcare system, but the uptake, as you know, has not been as fast as we would all like to see. We believe that nurses are the key to propelling that work to move forward. Our convention aims to explore and share how nurses are driving the shift to primary health care. I'm eager to be part of the next 2 days of our conference together. Continuing with my theme of Lead Always, CNA and our Indigenous nursing partners have taken a strong leadership role related to the health and well-being of our Indigenous people. I will take many gifts away from CNA in the work we've done together, but this will be the most significant of all the gifts. CNA and the Aboriginal Nurses Association of Canada, now known as the Canadian Indigenous Nurses Association, CINA, were especially vocal when the Auditor General released his 2015 findings on access to health services in remote First Nations communities. CNA and Canadian Indigenous Nurses Association also began discussions to formalize our long-standing partnership. Throughout 2015, we worked on the guiding principles for a formal partnership for authentic engagement, and professionally and personally, I'm very, very proud of this work and the partnership accord that was signed in early 2016, and of the commitment of Lisa Bourque-Bereskin to make this reality as president of CINA. As we saw leadership in the making yesterday, when more than 165 registered nurses attended the Dorothy Wiley Health Leaders Institute one-day program. For more than 15 years, this wonderful institute has been bringing together healthcare professionals, and to date, over 2,300 for a concentrated study of leadership principles, model skills, and tools. CNA was honored when the program's facilitators approached us to jointly deliver the program and to extend its reach. We officially signed a memorandum of understanding in December and were touched to have the program's namesake, nursing leader Dorothy Wiley of Ontario, at the ceremony. I'm sure yesterday's participants will attest the Institute is an excellent professional development opportunity. As you know, the work of CNA is done in collaboration with and on behalf of our members. This year, CNA experienced several membership-related changes and challenges that I must share with you. It is without a doubt a year of transition for us. A few weeks ago, CNA had to provide our jurisdictional member for Ontario, RNAO, with notice of termination of their membership in CNA. This was a very difficult decision for me personally, as well as for our board, and was not taken lightly. As you know, in 2013, RNAO chose to go to voluntary membership in CNA, a decision that had several impacts. Last year, at our annual meeting of members, delegates voted that voluntary membership was not beneficial for an association like CNA, which is the voice of nursing, both on the national and the international stages. And the delegates voted for a nested profession, province and territory nested into the nation, and nation nested into the international realm. A united approach was the best approach to be able to bring forward changes in national and international health policies. For RNAO members in the room, we have posted information on our website to inform you of your membership and the accompanying benefits that do not change for this membership year. They remain the same. I encourage you to read this as well as the background and the Q&A sections. There were also membership changes in the province of Manitoba. This was brought on by the introduction of the Regulated Health Professions Act in Manitoba, which noted that regulatory bodies could no longer be associated with advocacy and lobbying work. For the College of Registered Nurses of Manitoba, it meant they could no longer be a member of CNA, which is an advocate for the nursing profession. CRNM has to be applauded. You worked diligently to meet the province's new legislative requirements, and a group of registered nurses came together called the Association of Registered Nurses of Manitoba to ensure they would continue to have an advocacy voice. It has been a privilege to work in concert with CRNM and ARNM and throughout this transition in CNM membership, which was finalized in March of this year. So in that province, we kept to the principle of a nested profession, and I'm very proud of that. A strong unified connection between the provincial association and the national group means a greater potential for effecting meaningful change in healthcare transformation. Numbers matter. Judith Shamian will be speaking at our biennial. She will tell you, I've heard her speak at ICN, numbers matter. It's power and influence. And now I have come to an end of this 2015 board report, which I have been privileged to present on behalf of my board of directors. I offer special thanks to the many individuals and groups that have made this work possible: CNA staff, our nursing colleagues, associations and their teams, and of course you, our registered nurse members. My term as president of CNA and chair of this board comes to a close on Wednesday. It has been a privilege. It has been an amazing journey, and I'm deeply grateful for the opportunities to meet and work with so many of you as we collectively uphold and advance our national CNA, and for the many warm memories I'll always carry and all the friendships I will hold most dearly. Thank you very much.